I rise in strong support of long overdue health care reform. We've been talking about health care reform since the administration of Harry Truman. It's time for action. Among the Jeffersonian rights enumerated in the Declaration of Independence, the first was the right to life. And yet today, with health costs spiraling out of control for millions of Americans, that right to life becomes more and more difficult to manage. While the need for some level of reform is clear, whatever reform the nation agrees upon must respect the right of individuals to continue to select their own physician. Assisting some Americans in accessing health care must not come at the expense of restricting health care access for others. We cannot have a government-imposed regime. We must respect people's right to maintain control over their current health care access and health care insurance. Having said that, America currently has the most expensive health care system in the world. In 2006, we ranked first at 15.3% of our gross domestic product in expenditure. Runner-up was Sweden with a socialized health care system. It was at 11.3%. On a per capita basis, we spend the most in the world, $5,267 for every man, woman, and child in America. And yet, if you look at our outcomes, we are in the middling ranks of industrialized countries in terms of outcomes. We rank 50th out of 224 nations in the world in terms of life expectancy. As a nation, we're spending more on health care than everybody else, but we're not necessarily getting the outcomes we need. Our challenge is to make health care costs obviously more affordable. A recent USA Today poll showed 21% of Americans struggling with health care costs, being able to manage it, significantly up from what it would have been a decade or 2 decades ago. Those who currently have and like their existing health care coverage still, nonetheless, often lament the rapidly increasing costs of premiums and recognize that we all pay a cost for emergency room treatment for those without health care coverage. In fact, it's estimated that that costs to everybody $1,000 per capita per year because of our fellow 46 million Americans who lack health care coverage. As we debate the various proposals, Madam Speaker, for reforming health care, I'd like to propose 5 principles that certainly will guide me and I think many others as we move forward various proposals. The first is every child in America should have access to health care. No child should go in this country without having access to health care. We know that, for example, a child without health care who develops appendicitis has 5 times a probable negative outcome in terms of losing his or her life than a child with health insurance. That's unacceptable, it seems to me, as Americans. Secondly, nobody should be financially destroyed due to a catastrophic illness. It's challenging enough to combat a deadly medical condition, but tremendous expenses incurred can wipe out a family's savings and indeed cost them their livelihood and their home. Third, insurance companies should not be allowed to cherry pick, and I'm a proud co-sponsor of a bill that would prescribe that. The whole point of having health care insurance is to share the risk. Previous existing conditions affect 45% of all Americans today. And indeed, if we all live long enough, every one of us is going to end up with a previous existing medical condition. The health insurance companies shouldn't be allowed to disqualify people in that case. Fourth, we must respect the right of our fellow citizens to choose the health care insurance and provider they want. Fifth, we must move toward universality of health care coverage. Everyone in America should have access to health care in this wonderful country of ours. Ultimately, we must address health care reform for a number of reasons: to provide broader coverage for those currently uninsured, to bring down the increasingly difficult cost of businesses, especially small businesses, families, and sole proprietors, and to reduce the growing strain of health care costs in our nation's deficit, and to improve the overall health of our nation. 50th place is nothing to be proud of, Madam Speaker, and I hope all of my colleagues would join me in supporting a health care reform program that will reposition America as a competitive, successful, and healthy society. I yield back.